meeting the guidelines of the perioperative management of patients with cardiac implantable electronic devices. This is a qualitative study to assess the approach of anesthesia NCHDs with a parallel educational intervention at University Hospital Waterford. Introduction. The use of cardiac implantable electronic devices, or CIEDs, has dramatically increased in recent years, resulting in substantially improved quality of life and increased survival of patients with cardiovascular disease. Consequently, more patients with CIEDs may be exposed to diseases requiring surgery during their lifetime. Appropriate perioperative management of these patients is essential to minimize the chances of electromagnetic interference, ensure patient safety, and prevent unnecessary delays to surgery. In this study, we aim to evaluate the current practice in University Hospital Waterford and assess for its alignment with British Heart Rhythm Society guidelines for the perioperative management of patients with CIEDs. We also aimed to carry out an educational intervention promoting up-to-date practices. Methods. We designed a 10-question scenario-based questionnaire to assess the approach of anesthesia NCHDs in managing different patients, to evaluate the precautions and safety measures that would be taken, as well as assess the perceived indications for device interrogation, deactivation, or reprogramming. This was followed by 3 teaching sessions on current guidelines on the perioperative management of patients with CIEDs, accompanied by a survey to evaluate teaching outcomes. Results. 20 NCHDs participated in the questionnaire. 14 or 70% demonstrated correct approach in perioperative management of CIEDs in surgeries above the umbilicus, and only 9 or 45% demonstrated correct approach in surgeries below the umbilicus. 19 or 95% recognized the appropriate precautions and measures, and 15 or 75% recognized the appropriate indications for postoperative checks. 3 teaching sessions highlighting up-to-date guidelines were carried out on 3 different days open to theatre medical staff. 9 of the teaching attendees participated in a teaching outcomes survey, 7 of which felt that the teaching improved their knowledge and was relevant and applicable to their role. Conclusion and discussion. The study results demonstrated suboptimal approaches to the management of patients with CIEDs that were not up to date with latest guidelines. Promoting guideline-backed practice will aid in ensuring patient safety, and the teaching has likely improved the knowledge and confidence of NCHDs. However, service improvement cannot be inferred as there were no direct patient safety or quality improvement outcome measures. A beneficial outcome of this study was the introduction of an algorithm to assist in the routine perioperative management of patients with CIEDs. This algorithm was added as a supplement to our hospital guidelines.